Under Age 65 project is an innovative model that's funded by the Administration for Community Living within the Centers for Medicare and Medicaid Services for the Center for Medicare Advocacy to assist state health insurance assistance programs and senior Medicare patrol programs to reach and serve Medicare beneficiaries who are under 65 years old. Today's program will be in 3 parts. So part 1 is where I will describe resources that are available for SHIPs, SMPs, and younger Medicare beneficiaries that have been developed by the Center for Medicare Advocacy and the Center's partners through the course of the ACL grant. In part 2, Michael Murray will provide insights from the disability community about where younger Medicare beneficiaries look for information and find resources. And then finally in part 3, Ben and Robert examine innovative programs and resources developed by the Social Security Administration to improve access to services and quality of life for younger Medicare beneficiaries. So just a refresher again on who are Medicare beneficiaries under 65. They comprise approximately 16% of total Medicare beneficiaries. Often they have lower incomes, require more health care, and find it more difficult to pay for and obtain care compared to Medicare beneficiaries over age 65. And they're more likely to have cognitive impairments, report themselves in poor health, and have limitations in one or more activities of daily living. So what are the primary impairments of Medicare beneficiaries under age 65? Most have qualified for disability due to 1/3 mental health disorders, 1/3 musculoskeletal connective tissue disorder, injuries, and cancer, and another 1/3 due to other diseases and conditions. So Medicare beneficiaries under age 65 have the greatest barriers to care in access that's often limited by cost. So barriers created by cost sharing or, for instance, transportation to get to care. With higher rates of health problems that require multiple provider sources. They generally have relatively low income with a lower use of office visits and a higher use of emergency room visits. So here in part 1, again, I want to just remind people of the resources that we have available that were developed in the course of this grant. So under age 65 webinar topics that are available or soon to be available in the SHIP and SMP resource libraries and on MedicareAdvocacy.org. So you can see there's any number of topics that we have covered in our past 7 webinars over the last year. And these resources are to be available. I won't take the time to go through them all. You got them in the slides, and we want to move along so that our other presenters can have an opportunity to give their information. So other resources, in addition to our webinars that are available in the resource libraries and at MedicareAdvocacy.org, include a Spanish translation of Webinar 1, links to resources for younger Medicare beneficiaries that are available from other agencies and organizations. The Centers for Disease Control and Prevention, Disability.gov, the Kaiser Family Foundation, Medicare, and Social Security Administration. We have a wealth of information that simply, not simply, but targetedly addresses younger Medicare beneficiaries from those organizations. We also have a compilation of articles and publications that are relevant to Medicare beneficiaries. And we have a fraud quiz where you can go and test your knowledge with questions and answers. And we have provided those answers as well. So resources that we will soon to have available, these include brief instructional videos of a length of 3 to 8 minutes on specific substantive topics. And we have decided, or we realized that sometimes it's just not practical for someone to go back and listen to an entire webinar to get the information that we need. So if you're looking to answer a specific question, you can get a targeted tutorial. And these are some of the topics under which we will be creating targeted tutorials. And we also would ask our audience to participate if you see a particular topic that you'd like to have covered that we haven't covered in this list, please let us know and we'll look to do that. We're also producing online brochures with an overview of Medicare information for younger Medicare beneficiaries, so these will be available for the SHPs and SMPs to retrieve. Toolkits for SHPs and SMPs to recruit additional counselors from disability advocacy communities in their local geographic areas. And we will complete our grant work with survey results from the efforts of this grant work and asking the SHPs and SMPs and the disability community to provide us feedback on how we've done in getting resources available for you to use.